Part 2 of ECG Made Easy. I hope you've seen the part 1 and all the other videos I've been uploading. So let's get to the rhythm. Now, to find the rhythm, you need to check the P waves and you need to check the relationship to the QRS complex. We normally use the lead 2. Lead 2 is famous because Apple Watches, now Apple Series 4 has P wave in it because it's the best way to find rhythm and atrial fibrillation and whatnot. So you need to see this lead 2. Is it regular or irregular? Is every P wave followed by a QRS complex? Is every time similar to the previous time? And if you are in doubt, then you can use this paper method. Put a paper above an ECG and just make small dots where you see the R waves and then compare them to a position later on or previously in the ECG. If they're same, then most likely there is no arrhythmia. If they're not, then you need to proceed to that. So you need to check the RR interval and the PP interval like this, and you get the look of the rhythm. A normal sinus rhythm. What is a normal sinus rhythm? The word sinus means basically in heart ECG normal, like the electrical activity is happening from the normal place it should be happening. Usually a normal sinus rhythm 60 to 99 beats per minute. Every P wave is followed by QRS complex. Every QRS is preceded by P wave. Normal duration of PR interval is 3 to 5 small squares. The P wave is upright in lead 1 and 2. So you see every P is followed by QRS. The duration is proper and it's upright in 1 and 2. What is sinus bradycardia? Sinus bradycardia is happening normally, but the duration between R is long and the refractory period right here is long, so the rate is less than 6-3, but otherwise it's normal. It happens normally in athletes and some other causes as mentioned before. Sinus tachycardia again would be more than 100. The RR waves would be closer together, but everything else would be pretty much normal. In conditions like the sick sinus syndrome that you get in really sick patients or in some other conditions, then you can get a missed beat. Now, sinus pause here, if you see right below the word sinus, the P wave was about to come right here. It was missed and came here. Everything else was all right. But if the sinus node does not recover, cardiac arrest can happen. This is a very important question. It normally always comes in examination. AFib is the most common cardiac arrhythmia involving the atria. Now, to find an AFib, the rate is usually around 150. The R's are regularly irregular. You put a paper down here and you know the R's, they're not matching with other R's. There's no discernible P wave. You try to find a P wave here, you can't find a P wave. The QRS is irregular and the length is usually less than 3 small squares. So the most important thing in AFib is the rate is high, the P waves are absent, the QRS are irregular. Atrial flutter. Now the difference is in atrial flutter you will see the P waves, lots and lots of P waves, and it will look like a sawtooth, and that's why it's called the sawtooth appearance. Atrial rate would be around 300, but every atrial P wave will not be followed by QRS, so you'll get a pattern, usually 2 or 3. So here you see in this example 2 P waves leading to QRS, or you can have 3 P waves leading to a QRS. It's how to differentiate. In atrial flutter you will see the P wave, in AFib you will not, and usually, if not all, atrial flutter is regular, AFib is not. Talking about ventricular fibrillation, go back to atrial fibrillation, you'll see it's irregularly irregular. Ventricular fibrillation is a very abnormal, severe, life-threatening emergency rhythm in which your ventricles just start fibrillating. They have an irregular rhythm. The direction of current in the ventricle is haphazard. So you get this kind of ECG in which you only see QRS complexes that are not well formed and weird, and does not have a P wave or a T wave or anything else. So everything is weird, and you need to take this patient to cardiac emergency as soon as possible. There's no proper rate, no proper rhythm in this one. In a ventricular tachycardia, it's also an emergency. It's a life-threatening arrhythmia. It can lead to ventricular fibrillation if not acted earlier. Now, here you see the ventricles have taken over. They've got no P waves, you've got no proper T waves, but the QRS complex is there. It's not exactly what you're used to, but it is regular and it is broad. It is more than 3 small squares. So regular ventricular rhythm, broad, rate 100 to 50. This is ventricular tachycardia. So say this point is twisting of point. Now what you need to remember is that you've got a prominent U wave. We'll come back to it later. QT is prolonged, and you suddenly get a weird QRS pattern. So twisting of points, polymorphic ventricular tachycardia. The change in the amplitude and direction of the QRS complexes, as you see here, is gradual, and rate cannot be determined, and the QRS complexes are twisted around the isoelectric line. Supraventricular tachycardia is a tachycardia that is originating above the ventricular tissue. That means the atria is causing this tachycardia. Now the rate is rhythm. P wave is not discernible because it's usually in when SA node is the functioning pacemaker, P wave is present. These are the example, usually does not come in your exam. Neither does this or this or this or this. So let's get to things that do. Here example of artificial pacemaker. Okay, thin spike you see right here and sharp, and obviously some part of the question would tell you about a pacemaker being inserted in the past or something of the indication. Let's get to the axis. I'll make it really easy. It is the general direction of the heart. A normal heart has an axis, and if it is changed, then some abnormality might be present. To find the axis of the heart, we can usually use the thumb rule. That's really important. Note the lead 1 and note the lead 3. If both leads have a QRS direction mostly towards upwards, and both thumbs will be up. Both thumbs up is a normal axis. Lead 1 will be represented by your left thumb and lead 3 will be represented by your right thumb. Now if the QRS is mostly upwards in lead 1 but mostly downwards, means the S wave is more than the R wave in lead 3, then your right thumb will be downwards. You will have a left axis deviation because your left thumb is pointing up. If in lead 1 the S wave is larger than the R wave and the overall direction is downward of the QRS complex, then your left thumb goes down and your right thumb goes up. In lead 3 the R is more than the S, your right thumb is up. You've gotten yourself a right axis deviation. So more on this, I hope, in some other video to find the axis of the heart. I'll explain it by demonstrating it myself. You can check it out. It's really easy to learn and really important. In this example, 1 and 3 are all both positive, both thumbs are up. This is the normal axis. Here your left thumb representing lead 1, you see the R wave, your left thumb is up, the S wave is deep. In lead 3 the right thumb is down. This is left axis deviation. In the right axis deviation, your left thumb is down, right thumb is up, and you've got right axis deviation. These are the causes. You can read them and note them if it comes in a question. Rest of the video will be in part 3, and I'll try to finish covering ECG with some important topics in the part 3. Thank you.